Reckless Hipkins Medicard, helping rich get richer. Hipkins clearly tries, amateurishly, to make Labour's Medicard sound compassionate. 3 free GP visits for everyone sounds caring, but in practice it will overwhelm a health system already stretched to breaking point. Medicard is an irresponsible, negligent idea. New Zealand's GP workforce is in crisis. Radiology is being outsourced, clinics are full, wait lists are growing longer by the day, and many regions are desperate for doctors. Introducing a policy that encourages millions of extra visits without first fixing capacity is not bold. It is gross stupidity. It is reckless.
When people can't afford to see a doctor, they stay sicker for longer. Fixing healthcare will be at the heart of the next Labour government, and that starts with 3 free doctor's visits a year for everybody. Because healthcare should never depend on your bank balance. Because healthcare should never depend on your bank balance. Because healthcare should never depend on your bank balance.
The core problem is brutally simple. There are not enough doctors, and no amount of political branding or Labour BS will change that. When you remove cost barriers, then demand rises. That is predictable and unavoidable because supply cannot magically expand overnight. Training a GP takes a decade. Recruiting overseas doctors is increasingly difficult in a global shortage. Immigration settings, including those linked to trade agreements, could easily increase the population faster than the health system and workforce grows. The result is obvious: longer waits, more pressure, and a system that will buckle under the weight of gimmick propaganda Labour policies, which have been solely designed as vote-baiting lures.
No one in New Zealand should have to choose between going to the doctor and paying for life's essentials. That's why we've announced the new Medicard. Every New Zealander will get one, and it'll come with 3 free doctor's visits every year. It means that when you're sick, you can see your doctor without worrying, and all you'll need is this: your Medicard. Every New Zealander will get one. Every New Zealander will get one. Every New Zealander will get one.
Medicard will turn GP clinics into bottlenecks. People who genuinely need care will find themselves waiting even longer because the system is flooded with additional visits, many of them for minor issues that were previously resolved without medical intervention. When access is universal and free, demand becomes infinite, but healthcare resources are not. That's a simple no-brainer, even for most Labour Party MPs. And Chris Hipkins wants to be the Prime Minister of New Zealand again? God help Kiwis should that occur. Think sick leave. Sick leave is also capped and isn't paid out when employment ends. This causes some people to take days off simply to avoid missing out on a benefit they've technically earned. Guess what will happen with capped free doctor's visits? Doctor demand and wait lists will increase because some people simply won't want to miss out on a free entitlement.
With this Medicard, every New Zealander will be able to access up to 3 free doctor's visits every year by letting them go and see the doctor for free.
Labour's lie in the sky. There are also legitimate concerns about the digital infrastructure required to administer the Medicard. New Zealand's health IT systems are fragmented, inconsistent, and a security risk. Trying to roll out a nationwide digital card integrated with every GP practice is a massive undertaking. If it fails, and there are many paths to failure, the consequences fall on patients, not politicians. Once the Medicard system is in place, means testing it later becomes highly likely. Hipkins has already indicated that Labour is open to means testing pensioners. Universal benefits so often start simple, then end up complicated. A digital card makes that shift very easy.
New Zealanders I talk to are fed up with a health system. They want a government that understands that cost should never be a barrier to seeing a doctor. And this is how we do it. It's our promise that good quality, affordable health care is for everyone.
Disgraceful funding mechanism. Taxing property profits may sound appealing to some voters at first glance, but it introduces a very worrying volatility into the health budget. Property markets fluctuate, healthcare needs do not. Tying an essential service, if not a critical service, to an unpredictable revenue stream is nothing more than Labour gambling with people's lives. This is an utter disgrace. Medicard is a classic example of a Labour Party policy that prioritises political optics over practical reality. It promises something that appears attractive on the surface, 3 free doctor visits, but without addressing the structural issues that makes access difficult in the first place. It's a nonsense policy, and the sooner voters realise that, the better. New Zealand does not need more demand, for goodness sake, but it does need more doctors, more nurses, more capacity, and until that is fixed, the Medicard will make the system worse, not better. Thank you for listening. WhangāreiTim.